We're here today with ZB, who's now completing his therapy sessions. He's graduating from therapy. What I'd like you to do, please, is put into your own words, what kind of problems did you have before coming? What happened that caused this? How did vision therapy help you? How did you work this into your life?
Sure. So what caused visual problems was a TBI. I think it was more of a whiplash situation. Didn't lose consciousness. Didn't even really bang my head the first time. And then a reoccurrence of the TBI did bang my head. And main symptoms for a long time, the best way I could describe it was a fogginess. After going through the program and learning a little bit more, going through it for a while, a lot of light sensitivity, difficulty focusing, would have to reread things, just difficult to work at the computer screen for work, stopped reading, comprehension was tough. And through the program, really noticed an improvement. Probably first in eye control, ability to focus, read, really look at a word on a page, improvement with light sensitivity over time, and after a bit, the general fogginess faded. That's a long story short.
And what caused the whiplash?
Really just falling to the ground. The first time, second time I bumped my head. There were two incidents. Really low impacts, playing backyard sports, going to the ground. Probably had a history of some things and definitely have some neck degenerative things going on. Found out after this as well. So kind of all contributed. Nothing major, but definitely didn't feel right.
How did you work therapy into your life?
It's just that when you don't feel good, you want to get better. So it's just an everyday thing. The first few months, it's very easy to find a few minutes a day to work it in. I was very motivated to feel better, even though I didn't have the worst issues, the worst injury. It's very persistently annoying part of your life. So I was very motivated to do the daily exercises.
And kudos to you, because like we said before, you've completed your program a bit faster than we expected, than we anticipated. And each person works on their own schedule, but the fact that you were diligent, that's why you were able to complete your program that much faster. That was great.
Yeah, 6 days a week for sure. Only day I didn't do my stuff was on my appointment days. The very last couple of weeks, I started skipping Sundays, but make sure I did everything, and it worked out.
Tell us about how much time you spend on computer now, and how this is different than it was before.
Yeah, when I first started, I didn't really have a choice. So for work, you have to be on, but after a few minutes, it's just brutal. So my days were brutal. If I could, probably 5 minutes at a time at first. I remember back when the original injuries were, I was seeing different doctors, and it was, on for 15 minutes, rest your eyes for 5 minutes. And that didn't really help. Now I don't really notice. I could probably do a full day's work with all my normal breaks.
That's great.
So it's been a really big improvement. I've been pretty busy lately, for sure. Actually, working long hours, and I take my normal breaks. Working from home, you get up, you walk around, take the dog out, it has not been affecting my work or computer times, which is great.
Wonderful. Any other parting words?
No. Happy to feel better. Program was great. The VT was great. Very diligent. It's tough. See, this was about a year in the making before I even came to this office, and saw a lot of doctors. You always feel like, there's never a lot you can relate to in the appointments. Not really sure what's going on. And in our conversations and in our appointments, I related to a lot of things. I felt like you really were able to pinpoint some very specific things and explain them. And, we built a plan around that. And yeah, I think the overall experience was great, and I'm feeling better. So
Wonderful. Thank you so much for sharing.
thank you.